Hello everyone, this is Dr. Anam Zahir and I'm here signing in at Instagram Live, episode 37 of Guest Talk with Homeopathy Heals. And this beautiful morning we have again came back to talk about scope of homeopathy in cancers. There was a time when cancer was known as incurable, untreatable, but homeopathy has, like other sciences, other medical treatment, has advanced. Not just it has become a curative science, but palliative care as well in terminal cases. I hereby welcome you all. Walaikum assalam everyone. So I would like to, good morning, I would like to add today's our guest of honor. Here any minute. Good morning, sir.
Yeah, good morning, Dr. Anu.
A very, very warm welcome to you.
Thank you so much.
Okay, so before we'll start the session, I would like to introduce you the today's guest of honor. He is none other than Dr. Manpreet Singh Bindra. He is BHMS, PGO in Homeopathy, DIH Home and CCH in Oncology. After completing his bachelor's in Homeopathic Medicine from Baba Farid University of Health Science, Punjab, he has completed his further study in Homeopathic Medicine in British School of Homeopathy in London under the blessed guidance of Dr. Samuel Hahnemann's great grandson, Dr. William Tankard Hahnemann, and Institute Director and Principal Dr. Tenwar M. Cook. He has got certified ACLS Blue Coat by American Heart Association at Max Hospital, New Delhi, and has completed his further studies in homeopathic cancer medicine under PG Home London from Hahnemann College of Homeopathy, UK. Dr. Bindra is a certified back flower practitioner under Center, UK. He has presented many clinical researches in international medical conference across the globe and has been awarded excellence awards from time to time by various fraternities both in allopathic and alternative medicine. He's been awarded as title of honor Modern Clerk of Homeopathy by Dum Spiro in 2019 at New Delhi, and he has been selected for the award of most trusted cancer doctor in Ludhiana by Prime Time Media, New Delhi in August 2020. Again, welcome to you, sir.
Thank you so much. So, first of all, welcome to all who are listening to us. And most importantly, thank you, Dr. Anum, for choosing a very specific topic because, see, when we talk about cancer in a general practice, homeopathic system is always lagging behind the diagnostic part, behind the prognostic part, and behind the management part. And she was talking like the palliative management because, see, in cancer, we know that the diagnosis sometimes comes at a very late stage and the patient is not able to get the proper treatment. So in that case, what we can do? Because, see, saving a life of a patient is every physician's dream. But what about those patients who are not able to respond to the standard line of treatment? Should we leave them to die? This is a very challenging task. That what about the terminal patients? What we can do for them? Because in allopathic system, we know that palliative management is very poor. Why poor? Because at that time, what they do, they simply say that a patient ko ghar leke chale jao. Whatever you can do, just do at your home. But I generally say that life is always pleasant, death is peaceful. But it is the transition that is from life to death that is always very painful. So that's why that transition should be the responsibility of the physician, and particularly if I talk about the homeopathic practitioners, I have encountered a number of cases of palliative management when we see that homeopathy is always leading much more ahead than the allopathic system in palliative management, particularly in cancer patients. So today we will be talking about everything, that what homeopathy can offer to the cancer patient, what is the Hahnemannian perspective of cancer, what should be the innovative management in cancer. Because, see, the old school is always saying that give this medicine to the patient and look for the response, right? But when we talk about today's scenario of the disorders, diseases, we know that that time is always very difficult for the physician to see that what to see as a response of the treatment, whether the patient is responding to your treatment or not. So many things are there. We will definitely talking step by steps today. Thank you, Dr. Anu, once again
Definitely.
for letting me join this session, and everyone who is listening to us. I hope they will be getting some benefit in their clinical practice also.
So without wasting a minute, we'll start the session. So my first very basic question is, what actually is cancer, and why we being Indians, we very much worried about it? Matlab, why?
See, cancer basically, if we talk like other disorders, in cardiac disorders, what we see, we have some pathology which is due to the buildup of the plaques in the heart, or it can be due to some sclerosis in the walls. It can be some physiological changes in the system that leads to hypertension. But cancer is nothing else that your own system is getting disturbed. Basically, it is what? It is uncontrolled growth of the cell division. Like if I say the cell, it should have a particular pattern or manner of division in the normal cell. But in cancer cell, what happens? That pattern is lost, and it is just like a rebellion. We generally in oncology we say this cell is getting like a behaving like a rebellion, right? Why? Because the same body. It why some authors have mentioned it as a parasite also. Cancer. Why parasite? Because it is feeding the same body where it is living. So cancer is nothing else, but it is simply a uncontrolled cell division in an uncontrolled manner. Plus, the most difficult task to manage is the metastasis. That the cell which is getting uncontrolled growth on a particular site, if I give an example of liver, if it is having a tumor formation due to uncontrolled cell growth on the liver, it now starts invading the surrounding tissue. This is the most biggest challenge for the cancer patients. So cancer is nothing else, but it is a uncontrolled cell division, and why it happens, that is a different part, right? And now talking about why the Indians should be worried about it. Very good question, because see, WHO was saying in 5 years back that by 2020, India will be becoming the capital of the world for cardiovascular disorders. But unfortunately, this population lagged behind in cardiac disorders, but we have now the leading patients more than the cardiac patients in cancer. And this is a very worrisome situation for the Indian population. If I talk about some literal figures, that the per 1 lakh population, per number of cancer patient per lakh population in India is highest in the world. So that is a big challenge. And I am dealing with the Punjab. So Punjab is now becoming the cancer capital of India. So these are things which we should worry about it, because the upcoming generations are definitely going to face this heat, right?
That's that's
Yeah.
very, very painful to hear from, a practitioner who is being into the field. So
Mm.
my next question is, how does cancer happens, and why it is becoming very much difficult for oncologists to treat it?
See, I told you that cancer is nothing, it is an uncontrolled cell division, right? But now question arises that why it happens. We always listen to the patient, the doctor, 3 months back I was totally fine. Suddenly there is a lump on my neck, there is a lump on my breast, there is a lump in my abdomen. Why it happens? This is the first question of a cancer patient always. So see, if we go very briefly into the cell cycle, we all know it is a very basic thing that we studied in our BHMS first, or even in the +1 or +2 also of the medical, right? So in cell cycle, there are certain checkpoints, there are certain phases of the cell cycle, like we talk about G1 phase, G2 phase, S phase, M phase. So basically what happens, there is a inbuilt system that whenever we have a error in the cell growth, so there are certain checkpoints. What they do, they just simply repair the cell, or they lead the cell into the apoptosis. Apoptosis is what? It is a programmed cell death, what we call. So these are the things which are happening in a normal person. But when a patient suffers from cancer, first thing happens is the mutations in the genes. Genetic mutations, we always talk about genetic mutations, but actually what they are? Genetic mutations are the things which are happening in the genes which are supposed to prevent these uncontrolled cell growths. Like if I say that I am a doctor and I am treating patients, suppose I am myself getting sick, who will treat my patients? The same thing is happening over here. The cell protein encoding genes which are supposed to repair the cell, they themselves are getting disabled, or you can say they are getting mutated, and they are not able to perform their normal functioning. That's why what happens? The cell cycle becomes a rebellion, it becomes uncontrolled cell division. They don't know when to die because apoptosis is completely lost in the cancer cells. So that's why the cells are growing multiple number of times, but they forget to die. Because in this universe, everything which has taken the birth, it should die
Mhm.
with the time, right? And suppose if you take an example like human beings, we all forget to die. If I become 150 years of age, what will happen? It will become a rush on this planet. It will become a bulky planet. So the same thing happens in the cancer. That's why we see there are tumor formation, there are enlarged lymph nodes, there are multiple number of blood cells circulating in the blood. So all these things happen just because the mutations in the cell protein encoding genes, what we call the genetic mutations. Yeah.
Very correct. My next question is, when we take a case, okay, we ask for the family history, and we these days it is very common that we get history of cancer in so many patients. So my question is, being you an expert, that is it that does everyone with a family history of cancer will get cancer in their lifetime,
So,
or any time
so
of their life?
yeah, this is very important question because I think this is the second question the family attendant will be asking to a doctor that doctor, my sister, my mother, my father, my brother, he has got cancer. Is it the next one who is me? But see, this should be answered very carefully. Generally, being a homeopath, nowadays I have seen some people because see, I am little bit critical also in some cases. Why critical? Because it should be a awareness to the colleagues also, to the upcoming generations, because I believe that whenever we have such sessions, 60 to 70% the attendees are the upcoming generation or the students of the BHMS. So see, nowadays people what they are doing, they are giving carcinosin to the people. You take this medicine and you will not get cancer in your lifetime. It is like a preventive medicine. So my request to all, don't behave foolish. Cancer till now cannot be prevented at all. If that can happen with carcinosin, I think the WHO will be the first one to take step and introduce the carcinosin to the whole population. Right? Now question is that whether if a family person has a cancer, it will go to the next generation or not. I will give you an example that we have two cell linings in our body. One is the germ line cell line, that is the parent inheritance that comes from the past generation to the next generation. Second is the this what we call the this somatic cell line, right? So germ cell line and somatic cell line. So germ cell line, suppose if you I give you an example that somebody's mother had breast cancer. Now coming to the daughter already has got the germ cell line from the mother, means 50% tendency is already there in that daughter, right? Now coming to the part that whether that daughter will be getting the cancer for sure in her lifetime, or is there a different chance whether it will be possible or not. Now comes to the second part, is the somatic one. The first germ cell line will be in the recessive form. Recessive form means it will remain silent throughout the life until and unless someone pokes it. Now coming to the mutation in the somatic cell line. Now if there is a mutation in the somatic cell line also, this will become dominant. The recessive one will become dominant. So now the chances are that 50% chances are always there in a person who has a family history of cancer. But that does not mean it will happen. So many patients come to me and they ask me that, sir, what to do if I want to become as a preventive from this cancer in my life, because my mother, my brother, my sister, all are suffering from cancer. Simple example and simple answer to this question is that you should behave into a natural manner. You should eat healthy, you should drink healthy, you should think healthy, you should sleep healthy. So that's why we should not give a trigger to that mutation that we call the carcinogens. We know that what are carcinogens? They are the cancer producing anything. If it can be environmental factors, it can be anything which we are eating, it can be tobacco, it can be smoking, it can be alcohol, anything. But nowadays, if we talk about homeopathic perspective, grief is also a carcinogen, right? Because in breast cancer patient, we see that around I see past history of grief. So we should always make sure that whether a person has a past history of grief, it should be a either it can be the causative factor or it can be the maintaining factor. So what we can do, 50% chances in a person is that it can be a risk factor for the person, that if your mother, father, brother, sister had cancer, you can be prone to that cancer. But 50% is in patient's own hands, whether he gives a trigger to that or not. And that can be preventable. The genetic mutation that we got from the family, that is not preventable because it has already passed from one generation to other. But the second
Right.
one is 50% part is preventable, and that is in the hands of the person particular, right?
Okay. My next
Yeah.
question is, sir, what are types of cancers?
Yeah.
How
Types
many
of cancer.
types we can see?
See, types of cancer, basically we divide the cancers in the this histopathologically, that from which part of the body they have originated. Like first we talk about carcinoma. Carcinoma are what? They are which are evolving from the epithelial cell lining. Second one we talk about sarcomas. What are sarcomas? Which are originating from the soft tissue, from the this bones, from the skeletal system, right? Then coming to the leukemias. What they are? They are from the white blood cells. Next comings are the lymphomas. What they are? They are the lymphatic system, where lymphatic system is involved. Next is the this what we call myeloma. Myeloma, what happens? The plasma cells. So depending upon the cells involved, the different types of cancer and which part of the body is involved, we differentiate, we stage, we name it as a primary site of cancer. So basically, histopathologically, carcinomas are there, sarcomas are there, leukemias are there, myelomas are there, and this lymphomas are there broadly, right?
Okay. So my next question is, what is Dr. Hahnemann's perspective about cancer and how homeopathy look it as a disease?
Yes, most important thing, like, see, let me tell you the biggest difference between an allopathic mind and homeopathic mind when we are dealing with cancer. Allopathic science says that cancer is a localized disease and then it metastasizes and spread to the other parts of body. This is what the oncology says and this is what the allopathic science says. But homeopathy is totally opposite to this. We say that this is a generalized disease which now resorts to the localized part. And that's why any patient who gets recovered with the homeopathic treatment does not have any chances of reoccurrence in the lifetime. Particularly if I talk about my experience, any patient, because see, cure rate is very less in cancer. We will talk about this later. But any patient who gets completely cured into complete remission with the homeopathic treatment, I generally tell them that 99.9% are chances that you will not get the cancer back in your lifetime. But in allopathic system, what happens? Within few days or within few weeks, it comes back after the chemotherapy, after radiation therapy, after surgery. Why it happens? Because they are treating it as a localized disease. They believe that if we excise the tumor from the body, it will lead to the cure. But it does not happen. Why? Because the genetic mutations are there, the cell linings are there, and they take another route and then they come from the other part of the body. Secondly, about the mental aspect of the cancer in homeopathic or Hahnemannian perspective, what we see, Dr. Hahnemann says there is predisposition, there is disposition. Then coming to the clinical part, see, genetic, because Dr. Hahnemann around 220 years back, he was already aware about the genetic at that time. See the beauty of Dr. Hahnemann's mind. At that time, he told that this is the part when your family can alter your upcoming this predisposition to particular disease. The medical science now says it has a family history, right? Like we say the tuberculosis, the miasms, what we use, the psychotic miasm, soric miasm, syphilitic miasm, tubercular miasm. And let me tell you, there are only 4 miasms. Don't go other than that. Because whatever Dr. Hahnemann said, that is the full and final thing. Nowadays, people are saying this is miasm, but that is not a scientific thing. Because see, Dr. Hahnemann, whatever he has said, that is up to the scientific part also. So now coming to the predisposition, then comes the disposition. Now see what happens. A small child, I am giving you an example with a small child. Like a child takes birth from a mother's womb and that mother had leukemia. Now what happens? This child has, I told you, 50% chances that this mutation will pass on to the germ cell line through the mother to the child, right? Now this child takes birth, comes out of the womb. Now the surroundings of that child, how he deals with this word, the stress, the anxieties, the fear, the physical traumas, the carcinogen exposures, that comes out to be the disposition of the child. Now, what happens? These two things will lead to the diathesis. Now, what is diathesis? That I am particularly, suppose if I take that example, that like if I have a family history of cancer, I have a family history of this blood pressure, I have a family history of kidney disorder. Now that is part of the predisposition, or that is a part of the family history. After that, I start taking alcohol, I start doing smoking, I start taking tobacco. That is my own exposure to the carcinogens. So now these two things will be leading to the total number of points, that how much I am exposed or I am prone to a renal failure, to a heart disease, to a cancer, to particular disorder. So that will be judged, or that will be calculated according to my family history, plus how I lived in this world, what I am eating, what I am thinking, how I am responding to the environment, and that will lead to the diathesis part. Now I am sure that yes, I am prone to this. This thing can happen anytime to me. Next comes the preclinical part. Preclinical part in cancer we call the pre-malignant part. Because see, cancer is not an overnight disease. It takes much time to come into a clinical phase. As per the latest research in the medical science, it is estimated that cancer can take up to 20 years to come into the clinical phase. That means if a child gets diagnosed with liver cancer at age of 40, by the time of 20 years of age, the changes started happening inside the body, and that came at the 40 years of age. So never believe that it is an overnight disease, because this thing cannot happen at once. And other research says that around 4 to 7 events or insults should happen inside the body, which should be a clinical evident cancer in the body. Because body has a very strong vital force inside. It can tolerate once, tolerate twice, thrice, fourth, but when enough is enough, it says now I cannot handle it anymore. So that's why it is not an overnight disease. Plus, the homeopathic perspective is totally different from allopathic perspective. We say that it is a generalized disease which goes to the localized site, but allopathy says it is a localized disease. It goes to the generalized site through the metastasis. Right?
Very correct, sir.
Yeah.
So my next question is, what is the role of homeopathy in cancers, and what type of approaches and drugs in materia medica we have to treat cancer?
Yeah. See, role of homeopathy. I told you that role of homeopathy is not stricted to only one approach. This is the first thing that I should explain. Why? Because see, when you are dealing with cancer, it is not an easy job. First thing. I always say to my colleagues or my students that don't take cancer lightly. Because so many cases we see, we don't expect a change, and suddenly the patient takes a U-turn. And we say that yes, this is a very good case. But other side, we expect that this patient should get recovered, but suddenly there is a U-turn, the patient goes into the critical or severe stage. Why this happens and what should be the approach? Always remember that our mind is like a parachute, right? And what is the role of parachute? That it should be open if you want to it function. अगर आप पैराशूट को लेकर 5000 फीट पे जाके पैराशूट को ओपन नहीं करोगे और सीधा जंप करोगे, यू विल फॉल. But if you open it up, it will save your life. The same is our mind. If you open it up to the open approach, see, Dr. Hahnemann has never restricted us to a single approach. This is an irony, I will say, or this is our misfortune, that people fed something inside our mouth by the time we were into the medical colleges, and we had to spoon fed that, and after that we should not think with our mind. Like the horses we see, they are running on the road with this on their eyes. The eyes are covered from both sides so that they should not look right or left. They should look straight. The same is happening with us. But we should do best. Now coming to the different approaches. See, it can be the constitutional treatment also. It can be the specific targeted drug also. Now I think this will be a new term for many, the targeted drugs in homeopathy, how it can happen. But yes, this is happening. It can happen, but this is happening. If you go into the research, because we don't study the scientific studies. I think 80% listening here, they are not aware of the ongoing scientific studies in homeopathy. And fortunately, homeopathic medicines are being proved by the allopathic scientists. You take any study, the in vitro study. Like if you give, I give you an example of conium maculatum, a very beautiful drug that we all use in the cancer patients, right? Everybody knows that materia medica says that conium maculatum tumors are hard, indurated, and like this and this. Anybody knows that how it acts? It works in cancer patient, but how and why? homeopathy is lacking behind the answer to why and how, and that's why we are being termed as placebo science, right? And nobody bothers about it. We have answers in our books, we have answers in our research papers, but we don't take time to read that. There are multiple number of drugs which have been well proven in the in vitro studies. Conium maculatum, Phytolacca decandra, Hydrastis, Hamamelis, then Scrofularia norosa, then Nigella sativa. I cannot give you a number. It is a huge list of cancer drugs which we are using in our day-to-day practice, but all of these medicines are well proven in vitro studies. That this, like if I give you an example of Conium maculatum, right? It has a very good seat of affinity of action on the breast cell line, right? And that's why when you give Conium maculatum to the patient, it targets that tissue and the patient gets good results. If we talk about Hydrastis scan, everywhere is written that Hydrastis is a very good medicine for the hepatocellular carcinoma. But why it happens to be a good medicine? This is the question. Why it works? But nobody is able to answer. That's why we are lagging behind in the scientific community. And people laugh at us. And this happened in COVID also. Which had arsenic will work as a immunity booster, arsenic will do this, arsenic will do this. But how it work? 99% homeopaths were not aware about it. And now see, Omicron came, the new variant. WHO says this is a new variant, but we don't need a new medicine. Why we don't need a new medicine? Now this time other medicines are functioning. Gelsemium is working, Brineia is working, Eupatorium is doing it. But why it is doing? Again, nobody bothers to answer that. So try to make sure that whenever you start reading a medicine, I will give you an example of any medicine, particularly if we take an example of C. hydrastis, right? In Materia Medica, it is written that Hydrastis hepatocellular carcinoma has a perpendicular type of tumor on the right lobe of the liver, right? Now, perpendicular tumor, that is the part of clinical examination. The patient will not tell you or even the radiology report will also not tell you that this is the perpendicular tumor. When you touch the patient, another perspective is that homeopaths don't touch the patient because we see that patient clinical examination is not required. Many medicines can be selected on the basis of tongue, on the basis of skin texture, on the basis of clinical examination, on the basis of spleen texture, on the basis of, like I told you, the tumor. It is perpendicular on the right lobe of liver, that is Hydrastis. Chelidonium, right? So first step is that you correlate the clinical examination part, physical examination part, plus the patient symptomatology with the drug. Now coming to the next part is the in vitro studies, that how this drug has been proved in the lab under the microscope. When they introduced the liver cancer cells, hepatocellular carcinoma cells with Hydrastis, with Chelidonium, what happened? Then you will astonish to see that yes, these medicines do work much faster than chemotherapeutic drugs also. But thing is that we don't know how to read, how to study, and nobody tells us, right? So principally approach should be very open in the cancer patient. It should be the constitutional treatment in the initial stages. Because see, constitutional treatment works through the vital force, through the vitality, right? But as the patient lands into the stage 3, we know the vital force is almost in the suspension. What Dr. Henneman has written is the suspended vital force. So when it is in suspension, the constitutional treatment may not work. So now what you need to do, take care of the treatment through some specific drugs, which has a very good affinity to tackle the situation, to target the cancer cells with their specificity. Like I told you, particularly for liver cancer, we have Chelidonium, we have Hydrastis, we have Chionanthus, we have Colostrinum. Other than that, we have Myrica. And all these medicines are being used in mother tinctures also in some cases. And now people will say, sir, आप mother tincture की बात क्यों कर रहे हो? Because using mother tincture in homeopathy is just like a crime, right? Many people say, why you use mother tincture? See, when you are dealing, अगर आप एक, this depends on that what type of practice you are doing, what type of diseases you are tackling with. If you are dealing with skin patients, you don't need to use mother tincture very often. You can give a very good 36C or 12C potencies also. But when you are dealing with a monster disease, that is a cancer, the drugs, the weapon should also be very hard. The second irony is who get a failure of treatment response in allopathy, they come to the homeopaths. Right? And now see what is the responsibility of a person who is handling such cases. That patient is already on the verge of the deathbed. Now they are expecting a miracle from the homeopath that he will save the person. Right? And one more thing, let me tell you that you should be very well and very clear to the family, to the patient, that what can be done and what cannot be done. Don't give false hope to the patient. Because I always say that homeopaths cannot put the scrambled eggs back into the shell. We don't have that power. Right? And so many people say, a patient ko leke aao, we will do anything. That everything makes a very bad image of the homeopathic community in the allopathic system. First, evaluate the patient, diagnose the patient, and in cancer, without staging the patient, you cannot even touch the patient. Stage the patient. What is the staging of the disease? What is it? Yeah, right? So try to make sure the approach should be on the basis of the time when the patient comes to you. If a patient of breast cancer directly comes to me in stage 1, definitely I will choose a constitutional dose for that patient. But when the patient has already exhausted surgery, radiation therapy, chemotherapy, and now he's coming to me, what I can do? I need something very strong to hit that cancer. Right? Different approaches, multiple approaches, but all should be in the streamlining of Hahnemannian principles. Clear?
Okay. So shall I pick up few questions from the audience?
Yes, sure.
Okay. So there's a question. What is the posology, or what is the dose of and repetition of drugs you choose for cancer patients?
See, in cancer, basically, it depends upon the, like I told you, the stage 1 patient who has came to you just with a small nodule in the breast. If you give, I take an example, stage 1, if it is stage 1, so nodule will be less than. We can take the queries from also. I can also question the audience. Is there any
Yeah,
provisions?
definitely.
Yeah. Because I
Definitely.
like to ask the things in the sessions. So can anybody tell me that what is the stage 1 breast cancer size of the nodule? I will try to give you prizes also, right, after this session.
Ah,
Yeah. Who will tell what is the size of breast cancer nodule in stage 1? See, people are
please
taking
drop
time.
your answers.
Yeah.
Yeah, please drop your answers in the comment section.
Okay, let them answer. Till them answer that if it is stage 1 and nodule is in the that size, when we call it stage 1, right? There is no lymphatic involvement. In that case, what we can do? We can start with a very good constitutional dose also. And in constitutional treatment, prefer to choose LM potency also, because we need frequent repetitions without any chance of aggravation. So LM potency can be used. Second thing is that if the patient has came to you in stage 2 or stage 3, in that case, sometimes I do take help of the this mother tinctures, or I do take help of some this triturations also, right? In mother tincture, standard dose is 10 drops 2 times a day, 10 drops 3 times a day, or in trituration, we can use 2 tablets if it is 3x or 6x, 2 tablets 3 times a day. If it is 1x, like thiosinamimum is a drug we use probably in the 1x potency, right? So in 1x trituration, we give 1 tablet 3 times a day. So posology, repetition of disease, all these things should be basis of the stage, that at what stage the patient is coming. Now, if it is stage 4 patient, the patient who has a very critical situation at the verge of the deathbed, and we are giving the palliative care to the patient, and so many times we need to repeat the doses at 1 hour or 2 hour also, right? So that's why I'm saying that staging makes your prescription, that what is the stage, what is your drug, what is your posology, what is the repetition. So that all depends upon the staging of the disease. So people have answered.
Yes, there are lot of answers,
Hmm.
and so many students they are writing 2 centimeter, up to 2 centimeter we have.
Yes, up to 2 centimeter without lymphatic involvement. That is the stage 1, right? And when we go to the stage 2, we have the ipsilateral lymph nodes. Ipsilateral means on the one side of the breast. If it is right, the same side of the breast will be having the lymphatic involvement also. Stage 3, it will be having the bilateral nodules. And in stage 4, we have the metastasis, that it will go to the liver, it will go to the skeletal system, it will go to the lungs. It is very easy. TNM staging, all these things should be on our tips. And this is the difference between an allopathic doctor and a homeopath. Right? So we should clear this gap so that we should sit with a confidence when we are talking to allopath. We are talking to a radiologist. Even I sometimes I encounter some situations when we have to correct the radiology reports also. That you have mentioned that the size is this, but I am seeing in the film that it does not look like this centimeter. So re-evaluate the report. Then they say that's yes, apologies, this is my mistake. So try to make sure that your radiology, your biochemistry, your pathology, physiology, histopathology, everything should be updated. Right?
Very true.
So next question.
So next question is, Dr. Jahan is asking, please share your experience with endometrioma.
Endometrioma.
Endometrioma case.
Yeah. Right. So endometrioma, see, in these cases also nowadays, what is the fashion? Anything happens inside the uterus, what they do? Remove the uterus. That's all. A very good thing. And very easiest way to tackle with the disease. But they don't believe, they don't accept this, that this is not the answer to the query of the patient. Why? Because the disease is still inside the body and it will now bounce back with a very harder bang. And that we see also. After removal of the uterus, every patient comes with a multiple number of disorders. In endometrioma, in endometriosis, or I will talk about benign and malignant also. In endometriosis, as per the allopathic concept, is a incurable surgical disease. And they have only thing that they can remove the uterus through hysterectomy. But I have multiple number of on-record evidence-based cases of endometriosis that we have dealt with exclusive homeopathic treatment and they recover within 3 to 6 months. Now endometrioma, endometrial cancer, ovarian cancer, uterine cancer, anything can be managed with homeopathy, but it depends that when the patient reports to you, whether it is stage 1, 2, 3 or 4.
2, 3.
And I believe that in my experience, stage 3 and stage 4 patients are most difficult one to treat. And that should be very much clear to the patient also, to the attendants also, that yes, this is the number of, my practice is that I always give it in writing on my prescription pad that yes, this is the number of percent, like 30% chances, 40% chances that your patient will respond to my treatment within this much time. And I have seen multiple cases who are being treated with homeopathic medicine that homeopaths don't go for the investigation. That's a very bad part. They don't reassess the treatment response. Like my practice, I do in cancer particularly, every 2 months or 3 months, we do the radiological investigation. So nowadays, we have very good number of tumor markers also. CEA is there, CA15.3, CA19.9, alpha fetoprotein, PSA. So everything you can do these markers can be repeated at 1 month interval also. So try to make sure when you are treating a cancer patient, your eyes should be open 24/7, that what is happening in this case. And there should always be a backup plan. Most important thing, there should be a backup plan that if this fails, what to do next. And that should be ready before the patient fails the first one. In endometrioma, chances are very good, but again, I told you that any cancer, any pathological disorder, it should be made sure that at what time the patient reports to. Right?
Okay, so there's a next question. How homeopathy can help in post-radiation? Patients of cancer, those being through chemotherapy, radiotherapy. So how homeopathy can help them?
See, most patients nowadays, what happens, they are aware about it and they come to you that, sir, I am getting radiation therapy and getting chemotherapy. Do give me something so that the side effects become minimized. We have very good number of drugs. If I give you an example of radiation therapy, the first choice is always the radium bromatum. And radium bromatum, if you give in 30C potency or 6C potency to the patient in repetitions, start it 2 days prior to the radiation, because radiations always go in a serial manner for 24 days, for 30 days, for 40 days, and ask the patient to keep it continuously taking till the radiation goes over. And what I have seen, around 40 to 60% radiation side effects can be minimized with the radium bromatum alone. Other medicines, what we use, like if there is a nauseated feeling, we can use apomorphinum, we can use ipecac. Other than that, if the patient has a diarrhea, we can use croton tick, we can use podophyllum, very small acute medicines. See, our approach should be very simple and very straightforward. Generally, what we do, we try to find a medicine which should cover the nausea also, which should cover the diarrhea also, which should cover the skin ulcers also. And we try to give only one medicine. See, we are dealing with a monster disease. What you can do, you can give Ipecac 200 or 30, 3 doses at that time. Now that nausea is gone, as soon as it is better, you can give the croton tick for the diarrhea. Now croton tick has recovered from the diarrhea. Now what you can do, you can go to the next medicine. This is how we deal with the cancer patients. And if we talk about chemotherapy, I will tell you about chemotherapy side effects also. The most important side effect of chemotherapy is the pancytopenia, like platelets will fall, TLC count, the leukocyte count will fall. What you can do? We have many number of medicines, like we have crotalosoridus, which can retain the platelet count of in a very good manner. Start crotalosoridus 6 or 30C before the chemotherapy, 2 days or 3 days before chemotherapy. And I have seen that 80% of patients, they don't need blood transfusion. This is a very good, helpful situation for those patients who have to take the blood transfusion after every chemotherapy. Other medicines, we have tinospora that we use in mother tincture form. So that can be used to induce the platelet production also. So try to make sure that select the medicines on the basis of the pathology in these cases, not symptomatology. Because see, nausea recovered by Ipecac is okay. Everybody knows that Ipecac is a good anti-nauseatic medicine, but why it happens? That is the question. And when you know about why, you will be seeing the beauty of homeopathy in a very broad spectrum manner. So next question.
The next question is, someone is asking, my dad had a radiation year ago on his calf muscles. His
Hmm.
muscles have tightened so much that his heel cannot touch the ground. Can homeopathy help in this case?
What was the cancer? See, we need to see that for what cancer. If it was sarcoma, what I am seeing, that if it was on the calf muscle, so might be it was sarcoma case, right? So in that case, you need to see that whether there is a fibrosis of that tissue or not. If it is having the post-radiation fibrosis, you need to treat that fibrosis, like calcarea floor is there, thiosinamimum is there, and other, if we talk about, many other medicines are there. So you treat that fibrosis, so it will soften up, it will becoming better. But if it is something else, you need to tackle it accordingly. But see, if it was a sarcoma case and post-radiation fibrosis has happened at the site of the sarcoma, then what you can do, you can think of the calcarea floor or thiosinamimum as per the symptomatology.
He is also asking, do you take clients in US?
Yes, we have patients from around 30 plus countries now. So you can take online teleconsultation and Zoom consultations also, and we will manage accordingly that.
So please, after the session, you send me the details how to take appointment. I'll post it in my story so that all the
Right.
students, those who want to consult
Sure,
from
sure.
you, can take appointments. Is that
Right, right.
okay?
Sure,
Okay.
sure. Sure.
The next question by Dr. Joshi, she's asking post-radiation lymphadenema of right arm with a female who had history of left radial mastectomy. So any specifics in this stage?
Please repeat the first line.
Post-radiation lymphadenema of
Hmm.
left arm with a female history of left radial mastectomy.
See, why this lymphedema had? Because the lymphatic system is blocked, right? So now simple thing is that we need to unblock that lymphatic system. So best medicine for this case will be the scrofularia nodosa, right? And scrofularia nodosa, if you start giving in the mother tincture, right, I believe that it should recover within 3 weeks.
Okay. So
Yeah.
there's another question. Some students, they're asking, is Banerjee protocol for cancers is really useful? What is your count on this?
See, my answer to this is that everything on this planet is useful if you think with your mind. Dr. Banerjee was a genius. I will say he was a genius, right? Unfortunately, we have lost his son also, Dr. Pratik also, right? But the protocol they have given, that is not only a protocol, that is their lifelong experiences. Like, see, I am a practitioner, only 12, 13, 14 years of experience, and I am giving you an ample number of drugs. And those people, they have treated cancer patients for more than 50 years. And if they are saying, yes, this should happen with this medicine, I think you should give a try to it. I will not comment that whether it will work or not. Try to make sure, do not ask from anyone, better try it yourself. If I say, like somebody asked me that this is lymphedema, I told that gives profularia, right? Now if she reads profularia nodosa, makes her mind much clear, now that will be a better chance of recovery. Because when the physician is confident, the chances of recovery are very high. And if you ask me that whether energy protocols are good or not, but see, anything I told you, anything which is knowledgeable, that should be very good. But thing is that how you perceive it. So try to make sure whatever comes on your way, read it, assimilate it, and whatever you feel is good, take it, rest, leave it. That's all. Because our brain is a very
So,
supercomputer. You can store many things in this. We don't have any issues with that. Yeah.
yeah, so we have Dr. Jitesh Sharma here. Thank you so much, Dr. Jitesh Sharma. He is the man behind this session. He,
Okay.
asked me, yeah, and he got
Right,
your
right.
email address to me. Thank you so
Okay.
much, Jitesh Sharma. I'm thanking you and I'm sending you my gratitude for this session.
Thank you,
Sir, our
Jitesh. Thank you
next
so much.
question is, so my next question is, what is your opinion in using protopathic medicines?
See, autopathic medicines, I personally don't use. Why? Because we need some scientific evidence-based researches on that. And unfortunately, we don't have that. Because see, when you are dealing with cancer, you are answerable to many people. You are answerable to the patient, you are answerable to the family, you are answerable to the scientific community, you are answerable to yourself. And when you ask yourself, suppose I give an medicine, like if I give conium maculatum to a person, right? And then I ask myself why I give conium maculatum to that person. The answer should immediately come to my mind. But if I don't have answer to that, that means I have done something wrong. So in totopathic approach, till now we don't have answer to these things, that why we are giving to this. And that is just like a hit and trial. And moreover, some research papers say that it has a very low success rate. So better avoid using, because see, now we have more than 5,000 drugs in materia medica. Why we need anything else? If I say another 50 years, it will take me to use every medicine. If I use one medicine every day, right? Every one new medicine every day. So why we need to look for any other thing? Like in this, what happened in this COVID-19, we were looking for a new medicine. There should be a Nozod, there should be Sarcode, there should be this or that. Why? When your current medicines are working in those cases, why we need to do anything else? Try to make sure the medicines which are being used for 200 years, innovate them in a new way. Like I told you, hydrastis, conium scrofularia, try to make sure that these medicines, the hidden secrets should be come out rather than finding out some new approaches. We don't need to go for anything else. We try to make sure that whatever Hahnemann has given to us, Dr. Hahnemann has given to us, we should explore it. Because sometimes I feel that Dr. Hahnemann should stay on this earth for another 20 years. Why? Because many things should be much more clearer for us.
Yeah.
Right? So try to make sure whatever Dr. Hahnemann has given, try to concentrate on that and make it more evident in the scientific community.
Yes.
Yeah.
Sir, there's a next question.
Mhm.
How you approach cases of leukemia?
Yes, leukemia, it depends again that what type of leukemia. If it is acute leukemia, your approach is totally different and it should be very extensive approach. If it is a chronic leukemia, what chronic leukemia? It is chronic myeloid leukemia or chronic lymphocytic leukemia. Because chronic lymphocytic leukemia is a very slow growing, and we know that for the first 3 to 4 years, we just observe the patient rather than giving a treatment, right? Now coming to the acute leukemia, which is a very challenging task. And moreover, I will say that patients still don't have confidence to take homeopathic treatment for acute leukemias. Because still there is a notion in their mind that homeopathic takes time to treat, right? So now coming to the acute leukemia, what should be the approach? Every acute leukemia will give you a trigger factor. It can be anger, it can be anxiety, it can be fear, it can be grief, it can be mortification, or it can be an allopathic medicine that reacted to the patient that we sometimes see in some cases. It can be some other underlying pathology which has the secondary manifestation as acute leukemia. So first of all, try to find out that. If you are very much sure about that, directly hit on that. Like if you take an example, if there is a person, uh, Because see, homeopathy is a very beautiful materia medica and property that we have the medicines for over expression of the joy also. I think this is the only science on this planet who tell you that if person over expresses joy, if anybody remembers the Malamal Weekly, this movie, there was a character Anthony who died of the with the news of his lottery that I got 1 crore
Right.
rupees lottery. Right?
1 crore.
What was that? That was the over expression of joy. That person could not assimilate that happiness. This thing also happens in some cases. Now, if somebody, what medicines we have, tell in this comment section, what is the best medicine for ailments from overexpression of joy?
I
There is
can
a very,
answer this.
yeah, I know you
Is
can
it
answer
coffee?
that. It is a coffee agro, yeah, right? So now, if you get this ailment or this specific cause in any, like in cardiac patient, we very commonly take this. Now coming to the opposite, if we have a specific mortification, like somebody says that he insulted me, and that is a very big sense of mortification for me. Anger, mortification, anxiety, we have Staphysagria for that. If we talk about suppressed grief and prolonged grief, we have Ignitia for the earlier stages, we have Netramule for the later stages. So these medicines can be used at that time also when we have a particular specific ailment from in that case. Right? And second thing is, if we don't find any factor, we don't know why it happened in this case. So in that case, try to make sure you choose the medicine with the specificity. Like if I give you the list of medicines for acute leukemias, we have benzinum, we have crotalosoridus, we have X-ray, we have cionethus, then we have chionanthus also, we have chininum ars, we have arsenicum sulf, we have kali iodatum, and I think 10 to 12 medicines are very specific for acute leukemias. If you select the medicines just on the basis of the pathology of the patient. Because when you study these medicines, you will see in X-ray what we see. We have the leukocytosis with lymphocytosis. When the TLC count is raised plus specific lymphocyte count is raised. So what happens in this? That is the lymphoblastic one. Right? Now we have Kali iodatum. This medicine has a specificity on the myeloid precursor of the cells, on the myeloid lineage. That we see in the myeloid leukemia, acute myeloid leukemia or chronic myeloid leukemia. So you can specifically select the medicines on these bases also. But make sure when you are dealing with the acute leukemias, you should be very much strong in your approach, because these patients take a turn within 5 to 7 days if you don't get a good response. Right? So your hold should be very strong in these cases, plus observation. Not only the clinical observation, the pathological and radiological investigation should be repeated as per the requirement. Sometimes we go for the CBC every day in these cases. So try to make sure you are very much clear that what case demands what type of approach and what type of observation in this case. Right?
Okay. Sir, we are taking a lot of your time. I have one last question, sir. Can you share one or two cases of yours
Yeah.
of
Cases,
cancer?
if I give you very best cases that I remind, there was a case of a homeopathic doctor's father. I will not name that doctor, but his father was suffering from the this DLBCL, diffuse large B cell lymphoma, right? So what happened to that case? That was a case of diffuse large B cell lymphoma relapse. The patient had, first there was a surgery, then there was a chemotherapy, 6 cycles of chemotherapy, then there were radiations. Again, there were 6 cycles of chemotherapy. Again, there were radiations. And unfortunately, now they told that you need to go for the stem cell transplantation or bone marrow transplantation. And that happened all in the AIMS, New Delhi. Then he called me, sir, that I'm very much troubled that what to do now. I told him that come to me, I will see what can we do. And that patient was a banker, a retired banker, his father. And I asked him that why this happened to you. And can you imagine, he told me that, doctor, this bank gave me the cancer. His wording was that this bank gave me the cancer. I told him, why this bank gave you cancer? Then he told me that, yes, this was the stress that I got in my life. This was everything was revolving around his banking job. So I asked him that whether you feel that this was the only cause of your cancer and this was a trigger. He said, yes, definitely. If I was not a banker, I would be healthy today. And based on that, we selected his constitutional treatment. And now tell me what can be the best medicine for this mind, side by side, right? I, I, I started with the constitutional drug. Along with that, I started with the this scrofularia nodosa mother tincture and Nigella sativa mother tincture. Alternate 10 morning, afternoon, evening, night, right? At a time, two medicines were given and constitutional treatment was given one dose every once a week. Can you imagine there was a around 12 centimeter tumor on his back, and that tumor started resolving within third week. From the third week, it started regressing, and within, I still remember that case, that within 4 months, that was a complete remission case. The patient was in complete remission, and I asked him to go to the AIMS again to get the PET CT. And AIMS doctors were astonished to see that why you have not taken this treatment earlier, why you were taking the chemotherapies. So till now, that happened in I think 2016 or 17. And till now, every 6 months, that patient gets a CT. For the first 3 years, we got for the PET CT. Now he's getting a CT scan every 6 months. And fortunately, till now, he's in complete remission. And one more year, he will be declared as a cancer-free patient. Because cancer, we take 5 years. Survival rate that after 5 years, if there is no sign of relapse, then we declare it as a cancer-free patient, and that patient will not get a cancer. Another case, if I tell you, that case was a chronic lymphocytic leukemia. Fortunately, that lady came to me very earlier, when only the TLC count was 1,60,000 or 70,000. Plus, there were cervical lymphadenopathy, plus there were some abdominal lymphadenopathy. And see, that patient was being treated by a homeopathic doctor of my local city, just like an infection, because he was not aware that if the TLC count is 1,50,000, what it can be. He said that there is some infection in your body that is causing this. Then they came to me, I told, this is a cancer, this is a blood cancer. And they said, sir, how it can happen? I told you, go for this investigation. And that came out to be the chronic lymphocytic leukemia. That lady recovered with the Netramure. Again, there was a grief. And the people who think that I don't take the mind symptoms, listen to this, I also take mind symptoms, right? So that patient recovered with Netramure along with the Cianothus. Only two medicines, and after that I gave her Calcarea Flor also. Right? So these way the patient can get recovered within few days or few weeks or few months also. But make sure your approach towards the diagnosis of the patient, your approach towards the prognosis of the patient, and towards the selection of the remedy should be very clear.
That's so good, because I must tell you this. When I posted about this session, then my inbox was full. People were spamming me. Ma'am, do you know he works over specific? Ma'am, do you know this doctor works over only organ specific medicines? And I have just listened to you only few times, you know.
Okay.
So even I was not having that clear picture of ideas. So I didn't answer either of them.
Right.
So I'll be just sending them the link of this session so they can watch the session, and they
I
can,
think
I'll send your email address so they can ask directly to you whatever the questions they
I
have.
think I have answered everyone that message you. Yeah. Because
Definitely.
see,
Actually, there's something very gross, you know, very irony going on in homeopathy. The people, even it happens with me also, if you're not taking mind symptoms, if you're not taking mind rubrics, so people, they won't consider you as a good homeopath.
not even a homeopath, not a good, not even a homeopath.
In homeopath. Okay,
Yeah.
okay. I 2 days back I had a discussion with my colleagues in homeopathy, and we were discussing a case of LVH, and the ejection fraction was very low. It was 27%, and few of my colleagues, they were behind me that I should give the constitutional medicine, I should give a deeper acting medicine, and I was, you know, unable to convince them that there is a Kent's 12 observation, and in the first observation, if you give deep seated remedy, you will lose the patient. So my
Yes.
approach was to give the specifics first. Let us increase or just elevate the vital force first. Then we'll think of some deeper acting remedy. And you know, I was looked at like, oh, what I'm doing. I'm not thinking about the mind. What patient is going through. Patient is 75-year-old. What
Yeah.
mind I'll get?
See, what mind also now tell me if I talk about cancer. And asking a cancer patient that how you are feeling at your mental level is just like a crime. A person who come to know that I am suffering from cancer and you are expecting him to become positive in his life, how it can happen, right? So
Yeah.
in when you are aware about that, which approach should be used in which type of case, in skin patient, in PCOS patient, in uterine fibroid patient, in infertility patient, in these cases you can take the mind. But asking a person that how you dream, a person who has a stage 4 liver cancer and he knows that within next 3 months I will die, what type of dream you are expecting from that person?
Yeah. And I think they should read the organon, because in terminal cases, mentals can only be taken as a concomitant. They cannot be taken as, for the prescription purpose. They cannot be taken as symptoms on which the medicine can be prescribed. They need to
Yes.
read the organ again, those who are
Yes.
spamming people
Actually,
or
see,
that you are not.
actually, people read organon, but they read in their own way. This is the difficulty. Aphorism 3 is the first, third aphorism of organon of medicine. What Dr. Hahnemann has written, that diagnosis of the disease comes first,
Disease
then comes
ology.
the diagnosis of the remedy, then you apply the diagnosis of remedy to the diagnosis of the disease. Then why people don't diagnose the case? Nobody diagnoses the
Very true.
case. And they say that we don't need diagnosis, we don't need investigations, we don't know radiology, we don't know lab investigations. Why? If this was the case, Dr. Hahnemann, Dr. Kent, Dr. Clark, why they mentioned this was the asthma patient, this was the uterine fibroid patient, they should have written only that this patient was having difficulty in respiration only. Why they use
Breathing.
asthma? They don't have
Yeah.
answer to this. Now talking
And
about this palliative mode of treatment. Dr. Hahnemann has written specifically, I think it is aphorism 66 or 67, because I am not very specific, this is the theoretical part, right? What I know that this has been written. Where it is written, I don't care about it, right? But it is written that when the vital force is in suspension, right? When the vital force is in suspension, at that time, you should use the palliative treatment also. And what palliative treatment Dr. Hahnemann has written, nobody answers to that. And I always say that mother tincture comes as a part of palliative treatment. Like you told about this LBF 27, right? I can tell you, if you choose Digitalis or Strophanthus mother tincture, only two medicines I am giving, no other case. I don't know about anything about the patient. Either give Digitalis Q 10 drops 3 times a day, or give Strophanthus Q 10 drops 3 times a day, and come with the echo report after 3 months. I can bet it will be more than 40% LVF. How I can tell you? Because I have treated thousands of patients of congestive heart failure with only 3 to 4 medicines, and they are responding much better than the constitutional treatments. So why we need? Patient needs to treat it. And Dr. Hahnemann has never written that you should not use mother tinctures,
yeah,
right?
very true. Very true.
Because we are
And
answerable to the patient. Yeah.
asking again and again to get the mentals, how you feel, do you feel angry, do you feel, if anyone asks me 10 times do you feel angry, I get angry over the physician.
No, no, no. Actually,
you
they
know
want that
you
you should
are
tell the first agree. Because they know that this person should be Nux vomica, and they make him Nux vomica till the time he becomes Nux vomica.
No,
And
very true.
nowadays,
So
the last,
they're
the
they're
last
they're
question,
fitting their rubrics to patient's
yes,
mind. They are
and
working in
then
a different way.
and basically what happened, the last nail to the coffin was the repertory softwares. What you do, what you put 6 to 7 symptoms, 8 symptoms in the repertory, and it tells you that what to give to the patient. And unfortunately, every time you repertorize any case, because I don't use repertory till now, I never use repertory. If I use only Mercury medical repertory, just to see the reference that whether this drug has a seat of action on the this disease or not. Natramure, lycopodium, phosphorus, sulfur, uh, thuja, carcinosin, all these medicines always come on the first 8 to 10 drugs. So
Very
that
true.
means the other 4,990 drugs are of no use in materia medica.
Very true. Very true.
Right? So this is the thing happening. People want that patient should tell them that I am Nux vomica and give me Nux vomica. Until the
Very true.
time they try to poke him, that become angry, show your bad side to me, and then I will prescribe you Nux vomica. And after 3 months of treatment, the patient will say that I don't have any relief. and then say that why this medicine does not work. But
Let's
they don't.
wait.
Yes,
Another thing is going on. Let's wait 3 months, 4 months. Let patient
see,
die.
see,
Let patient becomes
if I,
gross, land up into
yes,
some terminal stage.
generally I say that if the patient is being named patient, that does not mean he should be patient, right? If a person of migraine, left-sided severe headache is happening to that patient, and that is a pulsating headache, throbbing headache, the carotids are throbbing of that patient, and you know this is a typical spigelia, right? And still you ask to the patient how you are feeling in your sleep, how you eat, how you drink. That is a stupid thing. You can simply give spigelia 30 to the patient 3 times a day, and I can bet it is the medicine which works more faster than the
Wonderful.
naproxen of allopathic system. Naproxen is a drug that they use in the allopathy for migraine. So why we don't use this? So what does it mean? That
Yes.
spigelia does not make any sense in materia medica? If you want to give Netromu to every patient. So
Right.
approach should be very clear that what you want to do in this case.
And I think there's some ego issues in prescribing, some small
Yes.
specific organ targeted remedy. There's a huge ego issues. Oh my God, you have prescribed Pix Liquida. We have so many big remedies.
Let me
Sulfur might
let me
have done
tell
that, Lycone have done that.
Yeah, let me tell you. You told me about Jitesh, right? Today morning I got call from Jitesh just before this session that sir, one of my
Oh,
junior doctor, he has some issues with his health. Please guide me. Now I am just giving you an example to tell that what is the difference. What happened in this case? The hemoglobin of the patient came to 4.9. His bilirubin is 3.2. Right? Now, what is the first thought comes to your mind? Bilirubin
like
is high.
liver is not working. Yeah, liver is not working properly.
Liver is not working. Anything else you can think
Working.
of? Anything else?
Jaundice, look for
What
the
else?
patient.
What else?
The
More.
bilirubin is conjoined or total or indirect or
Total.
indirect?
Total is for this 3.2 and indirect is I think 2.4. Indirect is high.
Indirect is high. Okay.
Yeah.
Okay, that means it's a blood disorder. Indirect is high, that means it's a blood
Yes.
disorder.
Yes. That
That's
is a
why,
blood
yeah,
disorder, right? You
blood
know this
disorder. Yeah.
because you have studied pathology. That's why you are
Yes.
answering this.
Yes.
Right. And the people who don't know about the path physiology of this bilirubin and hemoglobin connection, they don't know how to approach this case. And Jitesh told me, oh sir, मैंने तो ये सोचा ही नहीं ऐसे भी हो सकता है. I told him that advise that patient direct comb test, DCT, because direct comb test will tell you whether it is autohemolytic anemia or not. Now tell me if I start giving any medicine, Myrica, Cheridonium, Chionanthus, Lycopodium, Nux vomica, what will happen? The patient will never recover. Patient will
Very
only
true.
recover when you know whether it is obstructive jaundice related to liver, whether it is viral jaundice related to liver, or is something related to the blood
Right.
dyscrasia, blood disorder. And then people
Very
say
true.
that I will give specifics, so I like it when they say this.
I have something to say. Those who
Yeah.
are asking me for about the specific your prescription, they are saying that they need more further sessions from you. So the purpose is solved, and I'm so much happy.
Right, right.
I
Thank
need
you. Thank
not
you.
to answer them in
I
that.
think they have seen the good side of me today also.
Definitely,
Yeah.
definitely, sir. Sir, I have one personal question. If a patient is consistently having low serum ferritin level,
Okay.
what can be done? Hemoglobin is fine, borderline. It's like 9, 10, 11, but the serum ferritin level is very much low. So
Ferritin
is
is
it
low.
a self-limiting?
No, it cannot be self-limiting because that means that that patient has difficulty in assimilation of iron, and that is related to the gastrointestinal system, right? So you need to see, simply ask the patient whether there is any bowel disorder, any loose motions, or any
Yeah,
constipation, right?
she
If
is
this,
a known case of APD.
so that in that
Known
case,
case.
you need to treat that, and ferritin will definitely go up.
Um,
Right, so this
that's
should
very
be,
true.
because when we are looking for the cause, everything has a cause. If we are sitting here, Jitesh is the cause, right? So everything has a cause. So that means if you deal with that cause, your things will be better. Otherwise, you keep giving the patient iron supplements, or you giving, like, somebody can tell you that give ferrum phos 3x, it will recover the patient. Many people have very specific approach for ferrum phos, but they don't know if the assimilation is poor, whatever you give, it will not recover, right? So better
Yes.
try to
Hemoglobin will only be balanced when we'll give till we give the medicine, the supplements. Hemoglobin is fine. Once you stop or withdraw the supplements, it will again fall.
yes, because that is compensated by just by the external source that you are giving through the supplement. So try to make sure where is the factor which is leading to this low ferritin level. So recover, treat that, and the patient will be having without any need of any supplements.
Okay.
Yeah,
So we'll be here at the ending of the session. I must tell you that we had more than 700 viewers today,
right.
and
That's good.
100 to 120 viewers were, continuously with us.
Okay,
And
thank you.
I'm
That's
so,
very
so
good.
thankful to you, sir. You have even opened my eyes. I'm even more confident while prescribing specific and organ targeted remedies, as if I'm not doing any sin and I'm not only in this
See,
in this
this
world.
is not a sin, because see, we are answerable to two people. One is God, one is patient.
God, patient.
We are not answerable to the people from other systems of homeopathy, or other gurus, or other fathers or mothers, whatever they call themselves. Because I always say, if I can justify my prescription, that means I am okay. Because there is a quotation that doctors are the only people on this planet who have to answer multiple number of lives when they go to the heaven or hell. Why? Because we are not dealing with our life only, we are dealing with ample number of lives. And nobody has given you the liberty to play with the lives of the patient. Nobody. Why? When you are, see, cancer patient is there, stage 3 or stage 4 patient is there, and you are giving Natramure 201 dose and asking the patient to wait. That patient has already limited lifespan. Life expectancy is not more than 3 months. Can you wait for 3 months? No, we cannot wait. We need to do something at very urgency. Either the patient should recover, or we should provide the palliative treatment to the patient so that the patient should die peacefully. Like I told in the first part of the session, that everybody is looking for the patients who want to live, but nobody looks at the patient who wants to die peacefully. And in cancer, ample number of patients come to homeopathic doctors to make sure that they die peacefully without hospitalizations, without pain, without any other complications. And that is also our responsibility. And if I say, if I give one dose to that patient, they will never recover. Not at all. Right?
Okay, so there's one last question. So your approach about lipomas.
Lipoma, see, I will say only 20% chances are that lipomas will be covered with your medicines. Only treat those patients. Like I told you, that what to treat and what not to treat should be very clear. Lipoma is not a this challenge for the patient. Yes, what we treat in lipoma, which is getting increased in size, or which is getting number of lipomas in the patient. So always make sure, take good fees from the patient, but don't misguide. Don't misguide. Unwanted medication should not be given. Because
That
in my city, I am known for being a doctor who generally give good advice to the patient rather than treating. Because I will say 10 to 20% patients I don't treat. I don't take their cases, but I tell them that yes, this is the right, this is the wrong. Because I am not a superman, I cannot treat all cases, right? And even homeopathy cannot treat all cases. We have certain limitations, and we should accept that. So make sure lipoma, if it is a small lipoma, you should not give any medicine to the patient if it is not painful, if it is not getting a increase in size. Yet if it is
okay.
causing trouble, you should treat it. We have an ample number of medicines, but my experience is only 20 to 30% is the recovery rate.
That's very honest and very kind of you, sir, that you are speaking of this on
Yeah,
social media platform. You're
yeah,
not,
my
you're
patients
not
are
throwing
also
it.
listening. Actually, my patients might be listening to me, so I should be honest. Yeah.
Sir, there's many students here asking which remedy you gave in the first case you told about of cancer.
People answered about any remedy. I asked
Do you
about
have
that.
any suggestions, people?
I
Yeah,
asked
they are
about
saying
the
just ma'am, please ask the remedy of first case, ask the remedy of first case.
Calcarea iodatum was the medicine. Over worries, over care, overburden is the Calcarea calm. Right? Now you can ask me that why I did not choose Calcarea car. Why iod? Because we need a remedy which should have a seat of action on the
Gland.
lymph node also.
Gland.
And that's why iodum component was required. And Calcarea iodatum was given in LM potency to the patient. Right? So Calcarea iodatum was the remedy, and I know that 70% of recovery was done by the Calcarea iodatum alone. So this should be your
Sir,
approach.
yeah. Sir, if I'm not wrong, we have some courses given by Bindra Multi-Specialist Clinic. Sir,
Yeah,
can you please
mostly
tell
actually,
about them?
yes, yes. Since the time of COVID, what we have done, we have started some online sessions about this cancer, about skin dermatology, about gynecology. So I try to make sure that whatever I know, I should spread to the people. Right? So in that case, we have only those people join that because they know that there should be a explored approach. Like I told you about cancer. In that, we start from the scratch. Scratch means from the physiology, from the pathology to the anatomy to the biochemistry, then leading to the histopathology, then leading to the cancers, then what is cancer, why it happens, homeopathic perspective, everything, whatever I know about cancer, I try to make sure I tell them in that sessions. So there are different, like in oncology, we have in dermatology, gynecology, in cardiology also, because cardio I have done for many years, so cardiology also. So we try to make sure that one session every week, and within 2 to 3 months, the person should be quite confident about the thing which he is dealing with. So that
So,
we are doing for.
those who are asking how to sign up for your online course, I'll be dropping all the details in my story. You can check. And do not forget to drop your feedback and learning from episode 37. Thank you so much, sir. I am so much overwhelmed, and it was such an
Thank you.
honest and eye-opening session. You know, there
Thank you
was
so much.
there was no ghee over the makke ki roti, not at all what you have shown us to. Such an
Thank you.
harsh,
Thank you so
such an
much.
honest opinion and your clinical experiences. I
Thank
am
you so
so
much.
much thankful to you. You spared a lot of your time for the session. Thank you
Thank you.
so
Thank
much.
you, Doctor. Thank you so much. Thank you, Dr. Jitesh, for giving me this opportunity to spend a very good time with you. Thank you so much.
Thank you so much.
Okay, thank you.
We'll be back next week with another guest talk. Stay tuned. Till then, stay fit, stay healthy. Homeopathy heals.